Hello everyone, I'm Dr. Sashi Kumar. I'm a plastic surgeon, and in this video I'll explain about gynecomastia and how it is managed. Gynecomastia is an abnormal bulge around the nipple areolar complex in adolescent boys and men. It is a soft and smooth swelling centering around the NAC or the nipple areolar complex. It is benign and it is rarely cancerous. The major problem with gynecomastia is that it causes considerable psychological and mental disturbance in the affected individual. Management is thus purely based on psychological and physical discomfort due to the abnormal bulge. An imbalance in the estrogen and testosterone levels during transition to adolescence is the major cause of gynecomastia. Increased estrogen levels in the body causes gynecomastia. Testicular and liver diseases also cause gynecomastia because of abnormal estrogen metabolism. Prolonged medication and therapeutic drug intake can cause gynecomastia. It is seen to run in families. Sometimes it can be spontaneous in onset. It usually starts in boys around the age of 13 or 14 years of age. The gland gradually increases in size. When there is excess chest fat, the gland in combination with the excess chest fat appears much bigger. Thus, it appears a grade bigger. Spontaneous regression of the gynecomastia is fortunately seen in about 70% of cases by about 18 years of age. It does not cause any functional problem, and rarely some people complain of mild pain around the NAC. We talk about the breast glandular tissue and the chest fat. These are the two main components of gynecomastia. The main thing is the breast glandular tissue. This is called a true gynecomastia. Cases where there are only predominantly chest fat, it is called a pseudo gynecomastia. Grades of gynecomastia: grade 1, grade 2 and grade 3. Grade 3 is a overhanging breast tissue. This picture is also seen in people who have lost considerable weight following bariatric surgery or due to exercising and dieting. Simon's classification of gynecomastia. Grade 1 has no small enlargement with no excess skin. 2A is moderate enlargement, no excess skin. 2B is moderate enlargement with extra skin. 3 is a overhanging breast tissue. How do we manage or treat a case of gynecomastia? There is no significant role of medical treatment. Medications do not work for gynecomastia. Liposuction and breast gland tissue excision is the major or the treatment of choice for management of gynecomastia. In pseudogynecomastia, where there is predominantly chest fat, diet restrictions and weight loss may help to some extent in reducing the size of the swelling. Liposuction is the key surgical step, and this is followed by gland excision. Liposuction is the key surgical step in the management of gynecomastia, surgical management of gynecomastia. This is followed by gland excision. Liposuction, if not done adequately or if not performed at all, and if only the gland excision is done, we find something called a saucer deformity, that is a depression in the middle of the chest wall around the nipple areolar complex. That is called the saucer deformity. In order to avoid this deformity and to obtain a smooth and reasonably flat chest wall, liposuction is invariably performed nowadays in all the cases of gynecomastia. This is a case of grade 2B gynecomastia with enlargement around the nipple areolar complex and fat around the lateral chest wall. Incisions are made on the lateral chest wall for liposuction. Sometimes we even make the incision a little higher up at this junction to remove all the fat around the entire chest wall, both sides. Following the liposuction, we give a small incision or make a small incision around the lower part of the nipple areolar complex, and the scar is rarely visible. Complications can include fluid collection within the cavity of the chest, beneath the skin. Sometimes there could be small blood clots. Bruises are seen in fair skinned people. Mild skin discoloration. Very rarely you can even have a outer layer of the skin peeling off. All these things settle down very well in about 7 to 10 days. Tissue swelling is invariably seen in all the cases of gynecomastia post surgery. Very rarely we see a larger blood clot, and this needs to be evacuated and sometimes in the operating room. Pulmonary emboli is extremely rare in small volume liposuctions. The risk of the risk to life is almost non-existent. How do we manage the case post-operatively? Surgery usually takes about 1.5 hours, recovery about 4 hours. Oral liquids and soft diet can be started after about 4 to 6 hours. Walking is allowed to void to the restroom. You can get discharged by the evening. Dressings are usually done on the second day. The drains are removed on that day and compression garment is given. Intraoperatively, during the day of surgery, we apply a tight compression dressing. Fluid collections, if any, are removed by gentle pressure around the chest wall on the second day of surgery. Stitch removal is usually done on the 8th day. We recommend avoiding heavy weights and gym activities for about 4 to 6 weeks. You can resume sedentary office work from the second day at home. You can physically go to the office about 5 days later. You can drive your car after 7 days. Further information, visit reflectaesthetics.com. Thank you very much.